The learning objective for the second lesson is becoming familiar with the categories in the WHO-UMC system for reports with the strongest evidence. It's helpful to look at the probable category. First, since most key reports are assigned to it as they fulfill the following criteria. The suspected adverse reaction is described as an event or laboratory test abnormality with a reasonable time relationship to drug intake. It's unlikely to be attributed to disease or other drugs. The response to withdrawal is clinically reasonable. We'll go through each element. Some examples of reasonable time relationships are firstly, and obviously, when the onset of the clinical condition was after the drug was started and not before. Or secondly, a drug suspected of causing a congenital cardiac defect, for example, was taken in the first trimester of pregnancy when the heart is developing, and not just in the last trimester when it couldn't affect the developing heart. To determine if the patient's clinical conditions are likely to be alternative causes, we need first to identify them from the medical history if it's provided. They can also often be identified from the indications for the medicines the patient is taking, including the indication for the suspect medicine. Other drugs the patient was taking, the concomitants should also be considered. Is the clinical condition a recognized adverse reaction to any of them? If so, is there a reasonable time relationship with their intake in this case? If the patient recovered when only the suspect drug was withdrawn, then concomitant drugs are unlikely to be alternative explanations. Lastly, the response to withdrawal, that is, de-challenge, should be clinically reasonable. That is, the patient recovered after the drug was stopped or the dose reduced within an expected time period for the particular adverse reaction. The WHO-UMC system category certain is rarely used. The requirements are very strict. The event or laboratory test abnormality must have a plausible time relationship to drug intake. The events cannot be explained by disease or other drugs. The response to withdrawal, that is, de-challenge, is plausible pharmacologically and pathologically. The event must be an objective and specific medical condition or a pharmacological phenomenon. Re-challenge is satisfactory if necessary. We will take a closer look at what these requirements mean and how they compare with those in the probable category in the next lesson.